Hi, I'm Kitty Lamprecht, and this is just before your decompression for spinal stenosis. So, decompression just means that to take the pressure off, and we do that by creating space. And then spinal stenosis mean narrow. So somewhere in the back, it's narrow. It's basically what it means. So. Let's talk about that, and I think it's firstly important to understand how your back works. So movement in the back takes place over two columns. So you have a front column where there is a disc that is a shock absorber. It's also it creates space between the vertebrae. And thirdly, it is a way of giving nutrition to the cartilage to maintain it. At the back, we have the small facet joint. It restricts movement, but it also allows movement. Those joints are like any other joints in the body. It's just very small, so it has got a capsule around it with some fluid in, and the bony ends are have a cartilage. So what happens is that because our disc has a outer rim of ligament and then a soft center, like a gel sponge type center, that is how it can absorb a little bit of pressure. It has pressure, like we have blood pressure. So, and if you think of blood pressure, if we push up our blood pressure, and especially if we maintain a high blood pressure, we can stroke. So in the disc, it can also tear the outer rim, and then some of the jelly can run out. But over the long term, if we maintain that, what we find is that the disc dehydrates. So that soft center becomes hard, and this then prevents nutrition of the cartilage, so the cartilage of the vertebrae deteriorates. At the same time, you have deterioration then of the facet joint. And the facet joint can, and it's a wonderful word, form bony spurs. So as the cartilage deteriorates, it makes very sharp little bony spurs that can then, grow into the canal and narrow it. It's also the capsule that can thicken, and that then narrows the canal. So all of this then narrows the canal where the nerve is running through, and it creates pressure on that nerve. And that is why we then have the symptoms of pins and needles in the leg, a leg that is very painful, especially sometimes if we walk, then it feels like it doesn't want to work. So Dr. Lamprecht is going to go from the back, and I know that he explained this to you, and he's just going to make a small window in the bony arch of the vertebrae, and thereby creating space for the nerve. He will also make sure under the microscope that the nerve is running free. So from our side, what is important is when you wake up. So when you wake up, you will be lying on your back. And after this, I will send you a second video that will show you how you can move in bed safely. But let me explain this. So when you wake up, you will be lying on your back. Lying on your back creates compression on the wound, which is important because it minimizes bruising. You will have a catheter in. You will have a drip on, and the drip in. The drip is to get pain medication, and you most probably will feel around your calves that there's something that squeeze your calf and then relax, and squeeze your calf and relax. that is quite important. That helps your circulation. So you're sleepy, so we don't move that much. So it's important that you feel that squeeze and relax. If you don't, then you must please notify the sisters and bring it to their attention so that you make sure that those things are on and working properly. After 4 hours, it is a good idea and that you ask the nursing staff to help you to turn. The video that comes next will show you how to turn. The turning in itself helps to minimize your muscle stiffness, and it makes getting up the next day so much easier. So then after 4 hours you can turn as many times as you want. If you sleep better on your side, then that's not a bad idea to ask them to turn you on your side so that you can have a proper night's sleep. Then the next day I will come, we'll get up and we will start walking, and then every day, as we progress, we will do a little bit more exercises, which I will also give to you in a program. So most of the information that I've just given you is also in the program, so not to worry to remember. I think just a few things. Before you start your fast, it's a good idea to eat something, like a sandwich or something. It helps to stabilize blood pressure. Then when you wake up, there is a lot of pain medication written up. So if you have pain, please ask the sisters to make sure that they've given you your pain medication. We want you to be as comfortable as possible. And you'll see that the pain really becomes easier the moment that we start walking. I hope you have a good evening, and I'm looking forward to meet you.